Hey, I'm Bernie Bro. How are y'all doing today? I want to talk about single payer, Medicare for all, and how it relates to national security. I have been a lifetime proponent of single payer or Medicare for all, universal health care. I just think it's a smart idea to have it. Um, and we need it. Uh, I have stated before, and it's been proven that if we were to have a single payer national health program, it would involve less red tape because if you don't have for the people and to hire more people to do work in the healthcare system instead of shuffling papers around, it would make us more competitive in the domestic economy and the global economy. Um, I have said this to a lot of people, and they find it hard to believe, but it's really not hard to believe that it costs more to operate a factory in the United States than a high wage place like France with strong unions. And that's because healthcare labor cost fits into healthcare. Healthcare is kind of wedged in the overall labor cost. This is why a lot of companies leave these shores because of medical inflation. And if we had it so that people can have health care and the companies don't actually have to pay for their health care for the employees, and it's a government system for the people, well, that means that companies will be able to have their companies come back here, their factories come back here, and will be able to keep the manufacturing base in the United States, and jobs will be preserved that way. The bankruptcies that exist would be pretty much eliminated. It's a form of welfare reform. You'll have less people on public assistance if you have medical care available to everyone. And it can be done by eliminating the insurance companies and allowing the U.S. government to negotiate for lower drug prices, which we are prohibited from doing at the moment. And even, dare I say, tort reform. Um, with regard to China, we get a lot of drugs coming from China. That shit's not healthy. It's a lot of it's not is not with U.S. regulations in a lot of ways, and some of the drugs coming here actually will make people sicker in other ways where they would have been cured or their situation helped otherwise. And it's a national security issue. So maybe we can to have safe drugs. You can either you can either get it from Canada, which a lot of the U.S. drugs go into Canada, and somehow it's cheaper for the Canadian people. But we can't have big government health care. But the United States will make it illegal and a criminal offense for you to go over to the Canadian border and buy cheaper drugs. What the hell is that about? Well, maybe we should start buying our drugs from Canada instead of China, or we could keep all the pharmaceuticals here. If it involves nationalizing the pharmaceuticals, hey, as I said, that might even go a little further than the NHS in Great Britain. Um, it's just some thoughts right now about healthcare and everything. So yeah, it's also a national security issue. And if it's a national security issue, it might even stand a constitutional test, which some people have said, well, we gotta have that kind of healthcare. It's unconstitutional. I'm not so convinced of that. If we're guaranteed life and liberty and happiness, the insurance companies certainly do not believe in making people happy, and they certainly eliminate people's lives due to their people's inability to pay for it. So, in a nutshell, folks, let's get rid of the insurance companies. Let's allow the U.S. government to negotiate for lower drug prices. Yeah, even get tort reform involved, to take care of the ambulance chasing lawyers where there's abuse in the legal system. And I would say go a little more radical and keep keep the manufacturing base here, even on healthcare. nationalize pharmaceuticals and make sure our pharmaceuticals are made here. I make no apologies for these statements, folks. I am Bernie Bro. Feel free to